Dr. Williams, I can speak to some of the research we're conducting through the Emory program of Georgia's CEAL, where we're talking with religious leaders around the best ways to reach communities, particularly Black and Brown Latinx communities around Georgia, through faith communities and through religious leaders, and to multiply religious perspectives and messages. The first thing I would say in response to this question, it's a great question, is that I'm not sure that public health officials are actually the best equipped to approach these kinds of declarations. We can only do that in any way that is effective if we're doing it in collaboration and partnership with religious actors, clergy and laity, who are present in local communities and who have been present in local communities for a long time. Mm-hmm. We've been conducting key informant interviews with religious leaders around Georgia on the best ways to build those kinds of collaborations and partnerships and the kinds of messages we need. And their input to us has been exactly what was reflected in this question, that it's this generation, the younger generation, young adults, late adolescents, young adults, and adults into their early 30s, who are the hardest to reach. One of our key informant interviews, who's a religious leader, a well-respected and established pastor who's been in leadership both in academia and with concerned Black clergy in Metro Atlanta, had 3 suggestions for reaching young people. One is to challenge misinformation. So to challenge claims in which a message that the vaccines contain a microchip, for example, mm-hmm. and then to overlay that kind of message with the vaccines are the mark of the beast with religious imagery and language, to challenge that in direct ways. And he mentioned 2 ways to do that. One is to encourage responsibility across generations, that there's a connection between elders, between those in midlife and the younger generation, and everybody has a responsibility for one another. And so taking this virus seriously and figuring out our responsibility to be part of a solution to it is all of our responsibility. And then he suggested that we have to multiply messages and multiply instances where there's communication, that religious leaders are stepping up to the plate to get vaccinated, to vaccinate themselves, but also to amplify those messages and those images with others outside of religious communities or religious leadership positions also stepping up to the plate in regard to prevention and vaccination efforts. He actually mentioned his efforts in talking with young people that, yes, he's gotten the vaccine and he's talked with them about that, but then he's also talked with them that Jay-Z has gotten the vaccine, and that that amplifies a message of his own kind of social position in a community with someone else who's well-regarded and established and is looked up to. And he thinks those kinds of multiplications and connections are really essential.
We actually have good data that's out there that helps us establish who might be the best influencer for a particular audience. And there is some data out there that talks about, in addition to what John was saying about how you can pair people together. Can you pair a public health person with someone in the faith community, and perhaps someone in the faith community that's a little closer to the age of the people where some hesitancy exists? Because the influencer needs to have that lived experience that the person who is hesitant has. And so there is some best practices out there that help us find who is the best influencer or the best messenger to carry the message which is going to have the best outcome for the lived experience that people have.
Thank you, Dr. Blevins, and thank you, Dr. Hines. Anybody want to add to that?
Yeah, one of the things that we've done is in our denomination is to pair young adults with a religious leader such as a bishop to talk about getting the vaccine done. We've found that to be fairly effective among young adults, because persons my age trying to talk to a young adult about getting vaccinated may not be the best approach. But when they hear other young adults who are their peers, age-wise, professionally, what have you, they're more inclined to at least listen to that person speak about their experience with taking the vaccine and their perspective on that. And so I would think that that is another approach. That clearly, if you're going to reach millenniums, you've got to have millenniums taking leadership in this, and not just those of us who are seniors.
The other thing that's helped us as well, too, if you go back to that lived experience, is to find that person who previously was hesitant, just like the millennials are, who eventually had the courage to get the vaccine, or who were afflicted by COVID and now can help other people understand better the importance of getting the vaccine. And those are the people that, for instance, we are focusing on mostly these days, because who's left out there that's hesitant they're a tough nut to crack. Mm-hmm. And some of the best influencers, again, I'm a big data person, what the science tells us are those people who previously were hesitant, who had that same lived experience that they have right now, who can come before them to provide information about hopefully giving them the courage to get vaccinated.